Hi, I'm Brenda Chase with Tuomey TV, and today we'll be visiting Todd Warwick at the Tuomey Pain Treatment Center. Hi, we're at the Tuomey Pain Treatment Center, and today I have with me Dr. Todd Warwick. Welcome to the show.
Thank you. Hey, how are you?
Great, very good, very good. Thank you for being with us today. Now, I understand you were trained at one of the most elite institutions here in the country. Tell us a little bit about your background and your training.
Sure. I did my medical school at MUSC in Charleston. That's where I grew up. Then I went to Houston for residency and fellowship. I did my pain training at MD Anderson Cancer Center. It's one of the most surgically focused and intense training programs in the country, which allows me to bring a lot of skills into my practice that I'd say the majority of pain physicians aren't allowed to do, and so I have a good scope of procedures as well as experience in both cancer and non-cancer pain that I bring to my practice and to the people of Sumter.
That's great. What brought you to Sumter?
Marriage, love. I met a girl from Sumter when I was in medical school and had the good fortune to marry her. We went out to Houston for training, and when we were looking for jobs back in this area, Sumter was just the right place for us.
Great. Glad to have you here. Now tell me a little bit about the practice. What all do y'all offer here at the Pain Treatment Center? Sure.
I would say that the bread and butter of what we do here is procedure and medication management. We see patients with a host of problems from back pain to sciatica. Of course, patients who have medical problems that have pain associated with them, like diabetes or cancer, we treat them as well. In addition to that, we're able to offer a significant volume of more advanced procedures beyond your standard back injection, knee injection. We're actually able to do things like treat spinal fractures with minimally invasive techniques here in the office or in the operating room here at Tuomey. We're also able to do trials of spinal cord stimulation, as well as intrathecal pain pump type devices, all of which are aimed to treat the hardest and most difficult pain patients.
Great. Now, if someone needs to see a doctor for pain, do they need a referral? Can they just call your office?
Sure. We've been taking self-referral for about 6 months or so now. It's going very well. We've really tried to open the doors to the community, and all the person needs to do to get an appointment with me is give me a call and give me some basic information. I just want to know who their regular family physician is so I can contact their office and get some of their old records, and that sort of speeds up the process. If they've had any previous imaging of their spine or their joints that are giving them trouble, we'll get some of that information as well. That way when we sit down to visit, the appointment can be as efficient as possible so we can go ahead and get started with treatment.
Wonderful. And you seem to have a great office staff here. You work very well as a team together?
Yeah, we have a lot of fun, that's for sure.
Great. Well, thank you so much for being with us today, and we really appreciate your time.
Thank you.
Thank you so much for joining us today as we visited Dr. Todd Warwick at the Tuomey Pain Treatment Center, and we look forward to seeing you again here next month on Tuomey TV.